After the age of 60, one of the most common yet misunderstood problems that quietly takes away people's freedom and independence is not heart disease, not diabetes, and not even arthritis. It is a very specific kind of pain, one that starts deep inside the hip, spreads through the buttock, runs down the back of the leg, and sometimes reaches all the way to the foot. This pain often feels like burning electricity or sharp, tight pressure moving through the lower body. Millions of older adults are told the same thing by well-meaning people around them. It is just your age, or you will have to live with it. Over time, they start moving less, sitting more, and gradually developing a fear of their own bodies. They stop doing the things they love. They become dependent on pain medication just to get through an ordinary day. But here is the truth that most people over 60 are never told. This kind of pain is not normal, and it is not something you simply have to accept. That traveling electric pain has a name. It is called sciatic pain, and in the majority of older adults, it does not actually originate in the leg where it is felt most strongly. Research consistently shows that more than 40% of adults over the age of 60 experience some form of sciatic-type pain. Yet most of them are either treating the wrong area entirely, using movements that can make the problem worse, or relying on medications that only mask symptoms without removing the actual cause. What makes this problem even more frustrating is that when the right approach is used, the right movements, in the right order, relief often comes not in weeks, but in minutes. This guide will walk you through the only 4 exercises you truly need to relieve sciatic pain from its root cause, safely, gently, and specifically designed for bodies over the age of 60. If you have been dealing with sciatic pain for some time, you have probably already tried many of the things most people recommend. You may have stretched your hamstrings, pulled on your calf muscles, rubbed the painful areas, used heat or ice, or taken over-the-counter medication just to function through the day. Some people are advised to simply walk more, under the assumption that movement alone will solve the problem. The issue is not your effort. The issue is direction. Sciatic pain rarely begins in the leg, even though that is where it is felt most intensely. In adults over 60, the true source is usually located higher up, either in the lower spine or deep within the hip. As the body ages, spinal discs naturally lose height, joints become stiffer, and certain deep muscles tighten from years of sitting and reduced movement. One of the most common and overlooked causes is a small but powerful muscle deep inside the hip that can press directly against the sciatic nerve, essentially acting like a clamp around it, without the person ever knowing that muscle is the problem. When you stretch only the leg, you are pulling on tissues that are not causing the compression. In some cases, aggressive leg stretching can actually irritate the nerve further, increasing pain rather than relieving it. Medications may dull the sensation temporarily, but they do nothing to reduce the physical pressure on the nerve. Once the medication wears off, the pain returns, often with more stiffness and even less confidence in movement. This creates a damaging cycle: pain, medication, rest, fear of movement, and then more pain. Over time, this cycle leads to weaker muscles, poorer balance, and even greater stress on the spine and surrounding structures. The real solution requires a completely different sequence. First, you must release the structures that are compressing the nerve. Then you reduce pressure on the lower spine. Next, you create space so the nerve can calm down and settle. And finally, you stabilize the body so the nerve stays protected during everyday movement. Without following this order, relief is usually short-lived or incomplete. The first exercise directly addresses one of the most overlooked causes of nerve compression in older adults. Deep inside the hip sits a small muscle that, when tight, can press against the sciatic nerve like a clamp. This tightness commonly develops from years of prolonged sitting, physical stress, and the natural changes that come with aging. Reducing tension in this muscle can significantly decrease sciatic symptoms. To perform this movement, sit on a firm chair with both feet flat on the floor. Place one ankle gently on the opposite knee, forming a figure 4 shape with your legs. Sit tall, relax your shoulders, and slowly lean forward just a few inches. Do not force the movement. You should feel a deep but comfortable stretch high in the buttock. Hold this position while breathing slowly. Inhale through the nose, exhale through the mouth. With each exhale, allow the hip to soften and release. Stay here for 20 to 30 seconds, then slowly return upright and repeat on the opposite side. If sitting is uncomfortable, you may perform this lying on your back, crossing one leg the same way and gently bringing both legs towards your chest while supporting the back of your thigh with your hands. Many people notice for the first time that the pain stops traveling down the leg. That is an excellent sign. It means the nerve is beginning to have room to breathe. After releasing deep hip tension, the next step is to reduce pressure on the lower spine itself. As we age, the discs in the lumbar spine lose height and the joints become less forgiving under load. When you stand or sit for long periods, gravity increases compression on the sciatic nerve. The second exercise temporarily removes that load and allows the spine and surrounding muscles to fully relax without any effort required. To do this, lie comfortably on your back on the floor or a firm surface. Place your lower legs on a chair, couch, or bench so that your knees are higher than your hips. Your body will naturally form a gentle Z shape. Let your arms rest at your sides and allow your lower back to slowly settle into the surface beneath you. In this position, the lumbar spine flattens slightly, tension in the surrounding muscles decreases, and pressure on the sciatic nerve is reduced. Many people notice that the burning or sharp sensation down the leg begins to fade within just a few minutes. Simply breathe slowly and naturally. You may stay in this position for anywhere between 5 and 20 minutes, depending on comfort. Adding a warm compress on the lower back during this time can further encourage muscle relaxation and circulation. When you are ready to get up, roll gently onto one side first, pause for a moment, and then use your arms to push yourself up slowly. Now that deep hip tension has been released and spinal pressure has been reduced, the third step is to gently create space where the sciatic nerve travels. This movement is particularly helpful for people who notice their pain worsens after standing or walking for extended periods. As the spine ages, it often responds much better to gentle forward movement than to rigid, upright postures. By bending forward in a slow, controlled way, the vertebrae separate slightly, reducing irritation around the nerve. Sit on a sturdy chair with your feet flat on the floor and your hands resting on your knees. Slowly slide your hands down your thighs as you allow your upper body to bend forward. Let your back relax naturally rather than forcing it to remain straight. Allow your head and neck to drop gently as if you are setting down a heavy weight you have been carrying for a long time. Pause in this position for a few seconds, breathing comfortably. Then return to upright slowly, imagining your spine stacking back up one segment at a time. Repeat this movement 5 to 10 times, staying well within a range that feels comfortable and pain-free. Many people notice that as they perform this movement, the pain begins to retreat upward toward the hip rather than traveling down the leg. This is a positive and important sign. It indicates reduced nerve irritation and is exactly what should happen. The fourth and final exercise is the one most people skip, and it is also the primary reason sciatic pain so often returns even after the other steps have worked well. You can release the hip, reduce spinal pressure, and create space for the nerve, but without muscular stability, the body will eventually fall back into the same patterns that caused the problem in the first place. After the age of 60, the deep stabilizing muscles of the abdomen naturally weaken when they are not used correctly. These are not the visible surface muscles. They are the deep core muscles whose job is to protect the spine during simple daily activities like standing up, walking, or even turning over in bed. When they stop functioning properly, the spine becomes vulnerable and the sciatic nerve is easily irritated again. To perform this exercise, lie on your back with your knees bent and feet flat on the floor. Place one hand on your lower abdomen and the other on your chest. Take a slow breath in through your nose, then gently exhale through your mouth. As you exhale, lightly draw your lower abdomen inward and feel your lower back settle toward the floor. The movement should be subtle, almost invisible from the outside. Hold this gentle contraction for 3 to 5 seconds, then completely relax. Repeat 5 to 8 times, focusing on smooth breathing and full relaxation between each repetition. Once this feels natural and comfortable, you may progress slightly by activating the abdomen the same way, and then gently lifting your head and shoulders just a few centimeters off the floor. Do not pull on your neck. Hold for 1 or 2 seconds, then lower slowly. This small, controlled action trains the deepest stabilizing layer of the core and over time builds the kind of internal support the spine needs to stay protected every single day. People who practice this exercise regularly report feeling more secure when walking, less fearful when standing up from a chair, and far greater confidence in their daily movement. That shift from fear to control is what makes long-term relief truly possible. To bring everything together instead of chasing pain in the leg, this approach works directly at the source. The deep hip muscle is released, so the nerve has room. The spine is decompressed, so pressure is lifted. Gentle forward movement creates space for the nerve to calm down, and deep core activation ensures the spine stays protected, so the pain does not return. These 4 exercises require no equipment, take only 10 to 15 minutes a day, and address the actual cause of sciatic pain rather than simply covering up the symptoms. Sciatic pain after 60 is not a life sentence. Your body is not broken. It is simply asking for the right kind of movement, done with patience, gentleness, and consistency. You do not need to perform these exercises perfectly. You only need to begin. Even practicing 1 or 2 of them daily can start rebuilding confidence, comfort, and stability in your body. Small actions, done consistently over time, create powerful and lasting change.